This is the time for facts, not fear, for science, not rumors, and for solidarity, not stigma, says the World Health Organization. And yet incidents of discrimination and xenophobia are being reported in different parts of the world after the outbreak of the new coronavirus. So what's the impact of unfounded fears surrounding the virus, and how to combat the outbreak of anti-China sentiment accompanying the virus? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Xin. A total of 20,438 cases of the new coronavirus infection has been confirmed on the Chinese mainland as of Monday, with 425 total number of deaths, according to China's National Health Commission. As numbers continue to rise, fears over the coronavirus have inflamed xenophobic and racist sentiments against Asian communities in some places in the world. Now, some Chinese students in Europe have reported being branded as a virus, and some even got attacked by local people. A French publication put words such as "yellow alert" next to an image of a Chinese woman wearing a face mask. How serious is this wave of xenophobia, and what are fueling such sentiments? Joining me for the discussion from New York is Teng, president of the America-China Public Affairs Institute. From Brussels, Pieter, the head of the Brussels office of Open Europe, a non-partisan and independent policy think tank. And by Skype from Brussels, Professor Robert Dingwall, professor of sociology at Nottingham, Trent University, with a particular interest in public health. Gentlemen, welcome to The Point. So a bit more on the latest statistics on this virus. We know that as of Monday, 3,235 new confirmed cases were reported. Among them, 64 new deaths were reported, whereas 157 newly cured cases were also reported. So let me go to Fred here. Upon these statistics, how do you look at the development or the mortality of this virus, and how dangerous is it when you take things into perspective?
Well, first of all, I think it's a tragic that so many people died, but this is unprecedented. And however, I think the Chinese government have done its utmost. I think when this is done with, the world will look at this as that they have done their job in terms of combating this virus. My worry is that there are a lot of attention to this 2019 NCOV virus, and they're taking away attention from other diseases and illness in the world, and I think that will be causing more problems.
What about the kind of racist or targeted attacks against Chinese people in your part of the world, in the United States? Have you heard incidents of this? Do you think these trends are worthy of our attention? Do they represent a rather general phenomenon, or just really single isolated cases?
There are cases. They are not in mass, but there are cases. Yesterday in New York City, in Chinatown, in a subway station, a person was attacking a Chinese woman because she was wearing a mask. Now, there is no confirmed cases of such virus in New York City or in New York State as of now. But people, and when you're looking at somebody wearing a mask, they have that stigma. And I do think this is racism. But this kind of racism happens not just on this incident, but in the past, when the Ebola virus was going on, Africans from all over the world were being suspicious of that. So it is a racism, and we have to be aware of it, and we have to deal with this.
Mr. Cleppe, let me ask you about Europe. For instance, we understand that, according to The Star, a Chinese student was attacked in Sheffield, UK, just because she was wearing a mask, very similar to what Fred was talking about. And then a similar case happened in Berlin, according to the German newspaper Die Welt, that also some Chinese people reportedly attacked because of their origin, or because they were wearing some protective masks. How prevalent are such incidents in Europe, and how do you look at it? How much concern should we be about these?
Well, there have been several reports about them, also about this newspaper that was mentioned earlier, about people that were sitting next to a Chinese person that was coughing in a plane heading to Europe. I mean, you can see that people really never tend to learn that that science is not always guiding people's behavior, that because they think somebody is not even from China but from East Asia, that this makes it likelier that they would be carrying the virus. I mean, all these attitudes are of course completely unacceptable. Thankfully, still isolated, but I think it's indeed very important that people are aware of countering these attitudes. Because I mean, this is very problematic. Somebody from the WHO was saying that the virus is under control at the moment, and now we have to get the panic virus under control as well.
At this moment, however, we are observing an upsurge of messages on the social media. For instance, I can just show you a couple of examples. For instance, this one by Dr. Nadia Alam, apparently from Pakistan. He says, "Today my son was cornered at school by kids who wanted to test him for coronavirus just because he's half Chinese. They chased him, scared him, and made him cry. I was the same age when I was bullied for being Pakistani. It's 2020. I thought things had changed by now." Then another message by this person, Ray. "First of all Asians are not Chinese. Second, all Chinese are not infected with the virus. Stop asking if we're dangerous if we cough while all the people around us are doing so. Thanks. Hashtag je ne suis pas un virus." I think that is the French way of saying I'm not a virus. And then this third message by this person called Millennial Mad. "It's a coronavirus killing Chinese people, not a Chinese virus threatening the West. Viruses have no nationality. Words matter." So let me go to Professor Dingwall. You study sociology and you have a particular interest in public health. How are you seeing the situation? Is it within your expectation? Do you think people are going to react more or less this way, or is there anything in particular about this particular outbreak that deserves our attention?
Well, I don't think there's anything very special about this outbreak in a sociological sense. Every outbreak of infectious disease since the Black Death in Europe in the 14th century has been accompanied by three other epidemics. An epidemic of fear, an epidemic of competing explanations, and an epidemic of actions in response to the notion that something has to be done, however useful or useless it might be. And what we're seeing through here is a running through of the same sorts of processes. What's unfortunate is that it's coincided with the rise of nationalist sentiment in many European countries and in the United States, where the fear of difference, the fear of novelty, the fear of social change is feeding in and amplifying the first of those epidemics of fear. I don't think that the rare attacks on Chinese people for wearing masks, for example, are fundamentally different from the attacks on Islamic women who choose to wear a niqab or a hijab. And again, we have sporadic sporadic events of that kind. And I think they're motivated by the same kind of anxieties about people who are a bit different from us, and a reluctance to accept and value those differences.
All right. Fred, let me go to you. What's your take on what Dr. Dingwall just mentioned, this combination of fear of this particular virus plus a rise of nationalism, of populism, of people's fear about things coming from the outside?
Well, I do think that is true because of the spread of nationalism all over the world, and this type of virus just fall right into that category. But I do want to say that while we have this kind of racism and discrimination and xenophobic going on, we also have other people do stand up. this coming weekend in Chinatown, there will be a New Year's parade. All the city officials all come out and tell the people that this parade will go on. And I think that also I have received voice of support from other community, the Jewish community and so forth, and seeing that we are facing this racism, they pledge their support to stand with us. So I do think a lot of good things are happening at the same time while these type of racism is going on.
Pieter, what's your take on the situation? I understand, of course, people's fear of this virus, which is so far unknown and still remains largely unknown to the human being. So I can understand the fears related to that. But on the other hand, of course, the populist sentiment, the basic popular sentiments that we have been talking about over the past few years, which has been rising in Europe. And do you also say that there might be some negative effects on people's reaction because of the long-term misunderstanding or lack of understanding about China or about the Chinese system, about the Chinese people in the eyes of people from different parts of the world? Pieter, do you agree with that analysis here?
Well, yeah, to a degree I do actually. I think the fact that Chinese culture in general is less well understood among Europeans than other European cultures, basically, it makes it more likely to see this backwardish reactions, and really vigilance is the eternal price for liberty. So it's just another illustration that old stereotypes, deep xenophobic thoughts are always there and need to be suppressed and should not be let loose. And particularly when there's a situation where not all the information is out there, simply because scientists are still guessing, okay, how dangerous is this virus really, how contagious, and are guessing in general about many other aspects of it. There's not a vaccine yet. I think that sort of that creates an environment where certain dark thoughts come to the fore, and the answer is obviously to counter them as hard as possible, and to choose for a scientific approach.
All right, let me go to Professor Dingwall before I have to wrap up this section. Professor Dingwall, you said in the article that we should de-escalate the war against the coronavirus. Exactly what you mean? Could you elaborate a little bit here?
I think the initial response of suspicion of action by the public health authorities in Wuhan was entirely justified. It was, we had no idea what we were dealing with. There are still large areas of scientific uncertainty, and I think it will be another 2 or 3 weeks before anybody can take a definitive view. But my own assessment of the emerging evidence is that this is not a serious disease. What we're being alarmed about is the novelty rather than the severity. And given that, we have to think about the proportionality of the control measures. If there are problems with food availability, with the availability of medicines, as I hear from colleagues in Wuhan, those are not things that we should be glossing over. They will come there will be a cost in morbidity and mortality that comes from them. So we've got to think about, is this international reaction proportionate to the actual level of risk that we're facing? And as the World Health Organization has been saying, it probably isn't.
Okay, thank you very much, Professor Robert Dingwall. I'm going to ask Fred one last question before I wrap up. Fred, what do you think should be done to help people maybe not suppress their fear, but express their curiosity or express their anxiety in a more rational way? It's okay that you're afraid, right? It's okay that you want to know more. It's okay that you might have some questions concerning that person who's sitting next to you, not too far away, probably coughing. What should people do, Fred?
I think people should really looking at the source credible sources such as the World Health Organization, the CDC in the United States, in terms of their numbers and their recommendations. And I do think that, you know, you're talking about this whole issue being infected about 20,000 people right now. But the flu itself in the United States is projected to be 10 to 25,000 people will die in the United States this year because just of the flu. And my question is, of all of those who have the fear of the coronavirus, how many of them haven't taken a flu shot?
That's a very good question. I don't know. At this moment, the Chinese people's senses about getting a vaccine for influenza has not been very positive, let's say. Hopefully, a lot of people will start thinking about that. Possibly, attitudes will change as well. Is that what you meant, Fred?
Well, I mean, in the United States, where a lot of people are being afraid of it, they have a vaccine for a flu, which is a different virus, but they're not even taking a flu shot, which projecting about 10 to 25,000 people will die in the United States of that virus.
All right.
And so why they worry about China, where there's not one case it's identified in New York yet.
Thank you so much. We're going to leave it there. Fred Teng, Pieter Cleppe joining us for this section of this program. You are watching The Point with me, Liu Xin. We'll take a quick break, and when we come back, it's a platform for keeping the public informed, but also a vehicle for rumors and misinformation. What role is media or social media playing in the outbreak? Stay with us.